Telmisartan is an angiotensin II receptor blocker, commonly known as ARBs. We have few other drugs with similar suffix like losartan, olmesartan, candesartan, irbesartan, and valsartan. All these drugs are angiotensin receptor blockers. These drugs inhibit the angiotensin II receptor activity. These drugs can be used as an antihypertensive drug. These drugs can also be used to reduce the cardiovascular diseases associated with the renin-angiotensin system. In this video, we will discuss about the telmisartan, how it acts. When there is decreased renal perfusion pressure and any other conditions like hypotension and sympathetic stimulation. In all these conditions, renin is going to be released from the kidneys from distal tubules, and this renin has a proteolytic activity and it cleaves the peptides which release angiotensin 1 which cause vasoconstrictions. In this way, renin increases the vasoconstrictions by increasing the renal perfusion pressure, and it also causes hypotension and sympathetic stimulation of the muscles. But clinically it can cause the arrhythmias, hypertension and heart failure associated with the renin-angiotensin system. Here telmisartan inhibits this renin-angiotensin system and it reduces the cardiovascular diseases like arrhythmias, hypertension and heart failure. From the liver, one of the precursor angiotensinogen is released from the liver, and it is a large polypeptide chain composed of different amino acids, but it is an inactive form and activated by the renin that is released from the distal tubules. This renin acts on the angiotensinogen and cleave the polypeptide chain and release the polypeptides. This is known as angiotensin 1. This angiotensin contains 10 amino acids and known as deca amino acid chain. And from the angiotensinogen, one of the polypeptide chain is released, which is a 10 peptide and known as angiotensin 1. But still it is an inactive form. Angiotensin 1 is converted into angiotensin 2, which is a 8 chain peptide by an enzyme, angiotensin converting enzyme. This enzyme is present in all tissues and abundant in the lungs. Within the vascular system, this is the only enzyme which can convert angiotensin 1 into angiotensin 2. So this enzyme can cleave the angiotensin 1 such that the last two amino acids of the angiotensin chain are removed, and this is converted into angiotensin 2, which contain 8 polypeptide or peptide chain. In the next step, angiotensin 2 is converted into two other types in such that the terminal amino acid is removed and it is converted into angiotensin 3. Then the one more terminal amino acid is removed and it is converted into angiotensin 4. In this way, angiotensin 3 have the 7 amino acid and angiotensin 4 having the 6 amino acid. But clinically, angiotensin 2 is the most important, which causes the vasoconstriction and reduce the blood pressure. Now angiotensin 2 act on the two receptors. The one is angiotensin 1 and second is the angiotensin 2 receptor. These are the receptors for the binding of the angiotensin 2 and known as angiotensin 2 subtype. Angiotensin 2 receptor will act on both of these receptors, and by binding on these receptors it has a different function. When angiotensin 2 bind to the AT1 receptor, cause vasoconstrictions and increase the secretion of aldosterone and hypertrophy. All these are going to increase the blood pressure as well as perfusion pressure. On AT2 receptor, it has different functions like vasodilation. Vasodilation is related to the release of nitric oxide, and it may also cause the proliferation and apoptosis of the cells. These are the functions of the AT2 receptors. Now the pathological function of the angiotensin 2 are related with the AT1 receptors. Interestingly, telmisartan act on the AT1 receptors and prevent the vasoconstrictions and decrease the aldosterone release and prevent the hypertrophy. Angiotensin 2 is the octapeptide and it acts on the angiotensin 1 receptors, which is a G protein coupled receptor with 7 transmembrane units. When angiotensin 2 binds with the AT1 receptor, It can activate the phospholipase C system. When phospholipase C system is activated, it cleaves the phosphoinositol phosphate into two parts. One is inositol triphosphate and other is diacylglycerol. This IP3 acts on the sarcoplasmic reticulum. This sarcoplasmic reticulum contains IP3 receptor. When IP3 bind on these IP3 receptors, it can activate the release of calcium ions. Similarly, diacylglycerol activates the protein kinase G. These can stimulate the inward-going calcium channels so that the permeability of calcium into the vascular smooth muscle increases. In this way, calcium level increase in the vascular smooth muscles, which causes the contraction of the vascular smooth muscles. That's why angiotensin II acts as a vasoconstrictor. It can also increase the aldosterone secretion and the proliferation by increasing the intracellular calcium level. Here, telmisartan is the one of the drug which can block the AT1 receptors and stop all the action of the angiotensin II. In this way, telmisartan prevents the vasoconstriction resulting in the dilatation. Then what are the precautions? This drug, telmisartan, is a teratogenic drug which can cause fatal toxicity. It can also cause the many other abnormalities in the fetus like hypotension. Because this drug decreases the hypertension, it may also cause the hypotension. And next one is the skull hypoplasia, which is the decreased skull size and also cause the renal failure in the fetus, and it can also reduce the amniotic fluid around the fetus in the mother, resulting in one of the condition oligohydramnios. When this amniotic fluid is reduced, it can cause the limb contraction and the less lungs development in the fetus, which mostly occur in the second and third trimester of the pregnancy. So in this way, we can say that all the certain drugs cannot be used in the pregnancy, and this drug can be avoided when pregnancy is confirmed. So this is the one of the precaution of the drug telmisartan. So this telmisartan can reduce the renal functionality, and the patient with severe CHF and the renal dysfunctions are not given with these drugs because this may further decrease the renal functionality. In these conditions, this result in the acute renal failure and low urine output, which is known as oliguria. What are the side effects? Telmisartan can also produce back pain, diarrhea. It can also produce abdominal pain, and it can also produce dyspepsia. In some patients, headache and dizziness is also seen by the side effect of this. It can also cause the upper respiratory tract infection, sinusitis, influenza-like effects, chest pain, cough, and pharyngitis. This drug can also cause the hypokalemia and the myalgia. And as you can see, this is the chemical structure of the telmisartan drug. Then after this, we can come to dosage. How it is given? It is given in the tablet form like 20 mg for